Thank you so much for joining Dr. Mia Presents a Women's Intimate Health webinar. Just to tell you a little about Dr. Mia, she's a board certified gynecologist with more than 18 years of providing superior gynecology services to adolescents and women of all ages, with an emphasis on prevention and lifelong wellness. Also known as the B3, which is Beauty, Balance, and Belief Specialist, Dr. Mia wants to teach you how to live a life of total wellness while enjoying everlasting intimacy. One last thing, ladies, we'll be dropping a couple of quick polls in the chat for you to answer. So give those an answer and we'll let you know the results of those. And without further ado, I'll turn it over to the spectacular Dr. Mia. Hi, Dr. Mia. Can you hear me?
Yes. Can you hear me?
Yes, ma'am.
Well, welcome, ladies. Thank you so much for taking time out of your Thursday evening to join me for this wonderful conversation. It is all about intimacy and women's intimacy solutions right here at MiBella Wellness Center. But today I want to teach you the importance of intimacy in your total wellness so that you can live your best life. All right, so now I'm going to try to switch those slides. I may give a couple more minutes. Okay, here we go. All right, so it is Dr. Mia, and as you know, she already told you, I am a board certified gynecologist. So in my practice, I focus on gynecology, hormone balance, as well as women's total wellness and intimacy solutions for women and men. But today we're going to focus completely on my ageless bells and women. So my goal is for women to feel good at all times. So that requires total wellness for many women, especially over the age of 35. That's going to require some hormonal balance, as well as your preventive measures with gynecology. And then as we age, our intimacy desires change. And so we want to make sure we're also focusing on our intimacy solutions so that we can feel good, look good, and age well. My goal is to ensure that women always experience everlasting intimacy as well as total wellness for complete happiness. And I decided to focus on these things because as women, we've not had many people to put emphasis on intimacy for women and always being able to experience great intimacy. When I grew up, a lot of women thought that as they aged, intimacy just kind of went away and it was just a normal part of life for it to go away. And today I want to show you the importance of intimacy and why it is so important to make sure that you maintain everlasting intimacy, not only for your relationship, but also for your total wellness and for your complete happiness and total wellness. My goal is to always teach women, and I want to teach you today how to improve your energy, how to maintain a healthy weight, how to also make sure that you're experiencing everlasting intimacy forever. And then I want to focus on your overall well-being. So my goal is for you to live a life of total wellness and experience your beauty, balance, and belief so you can always live well, age beautifully. All right, now I'll go to that next slide. So I'm going to tell you a little bit about my story. Okay, I've done a lot of things right. I've also done a lot of things wrong. So a little bit about my background story. Many of you already know I was born and raised right here in Birmingham, Alabama. I was raised with my mom and my dad, and my mom was a great Southern cook. And I didn't realize how good of a cook she was until my parents divorced, unfortunately. But when my parents divorced, my mom started cooking her food differently. So she put more spices in it. She put more onions. It was so much more flavorful because my dad did not like all of that flavor in his food. So as I got older and she changed the way she cooked, I unfortunately fell in love with food. So as a result, I was always on a diet and I've always had to watch my weight because I enjoyed eating great food all the time. But as I aged, I learned that I can do one of two things. I can either eat great food all the time and enjoy great food, or I can choose to limit the great food, which made me gain weight so that I can maintain a healthy weight and live my best life. So like I said, I've been on a diet since I was in college. And so I had my first baby at 33. And when I got pregnant with my first daughter, my only daughter, I was able to eat anything I wanted because for the first time in my life, I was not on a diet. So I could enjoy milkshakes, I could enjoy hamburgers. And before that, in order for me to maintain a healthy weight, I had to monitor what I ate during the week. I could have some fun on the weekend, but I noticed that as I got older, I could no longer do that. So when I got pregnant with my baby, I was like, okay, we can have whatever we want. Let's do milkshakes, let's do hamburgers, let's do all this great food. So I enjoyed my pregnancy, but the problem was that I gained about 60 pounds during my pregnancy. And because I was over 30 when I had my baby, that weight did not just melt off or fall off. And so I learned that after telling my patients for years and years and years, lose the weight, stop eating as much, and start exercising so that you can lose the weight and maintain a healthy weight. Well, by experience now in my 30s, after gaining 60 pounds with my baby, going through postpartum depression, I learned that it's not as easy to lose the weight as I thought it was. So as a result, that's what got me into weight management. I went for special training in weight management, and that's how MiBella Wellness Center was born. So I started MiBella Wellness Center with the focus on gynecology as well as weight management. When I was able to go to my training, I learned how to lose the weight. I learned behavior modification, and I learned how to keep the weight off. I was starting to feel better about myself because I noticed that when I had all of that weight on, I was starting to have knee pain. I was more irritable. I wasn't happy with myself. And I was very frustrated with myself for not having self-control and being able to lose the weight. Because of age, it was harder to lose the weight. And with age, you naturally lose testosterone, which is that what I call forgotten female hormone. And when your testosterone levels start to decline, you start to notice that you're losing muscle. So you start to notice that you may start gaining weight in your abdomen. And as a result, it's even harder to lose the weight. But with that testosterone loss, you also notice other symptoms that go along with that, like fatigue. So you're not feeling like you want to exercise as much. The decreased metabolism. So that means that you can be eating the same that you were eating 2 years before, but now you're going to gain weight because your metabolism has decreased because of the loss of muscle mass. You start to notice that your clothes don't fit the same. You're losing that muscle mass. And as a result, it's much harder to lose the weight. So in the past, when I gained weight, I was able to just exercise and eat right during the week, take off on the weekends, have a good time, and I could still lose that weight. Well, in my 30s, my body no longer worked that way. So after a lot of training and after trying several different diets, including fad diets, like we've all tried, after the training at the Center for Medical Weight Loss, I finally learned the right way to lose the weight, and I was able to keep it off for a few years. So I was feeling good about myself. I had started my new practice. I was an entrepreneur now. I was working all the time. I was excited and loving what I was doing. I had finally gotten that weight off. I was feeling confident. And then I noticed maybe in my mid to late 30s, probably around 36, 37, I noticed that I was starting to feel tired all the time. And not only feeling tired, but I was even having some joint pains. And what was most frustrating is after all of that hard work with me losing the weight, I was now regaining the weight, even doing all the right healthy behaviors and doing all the things I learned with my weight management training. So I was frustrated. I was irritable. I had more anxiety. I wasn't really depressed, but my mood was down more. Then I started to notice that I wasn't sleeping as well. So I was starting to wake up in the middle of the night. I was starting to have night sweats. And what was worse than that, my intimacy desire started to decline. So I was no longer interested in having great intimacy with my husband. And when I did, my enjoyment was not where it used to be. So I wasn't experiencing that great climax that I enjoyed when I was much younger. Not only that, I was starting to feel like I was getting adult ADHD, meaning I just couldn't really focus and concentrate. And I really needed that focus and that concentration for my job and for running my practice and for seeing patients and for raising my daughter. So with that being said, with me noticing the fatigue and noticing these symptoms, I was like, well, my patients have been really complaining about many of these symptoms for some time now. So I went into deep research to figure out what was going on and why I was having these symptoms. Because I was no longer doing OB, meaning I wasn't delivering babies anymore, I had a population that was full of women who were what we call perimenopausal, meaning those women in their late 30s all the way to their 50s. And then I was starting to have a lot more postmenopausal patients. And I noticed that many of them had some of the very same complaints: the fatigue, the night sweats, not being able to sleep, decreased sex drive, decreased enjoyment of sex, the joint pain. And then I had never, ever gained weight in my abdomen. I was the person who gained weight more in my thighs and my hips. And now I was starting to get a pudge. So I was very frustrated with what was going on. And I went into some more research. I was already starting to dibble and dabble in hormone replacement therapy, but I was already starting to dibble and dabble in hormone replacement therapy, and I was starting to go into the natural hormone replacement therapy because I found that what I learned in residency, which was to give women, once they were truly postmenopausal and their estrogen levels went down, to just start replacing their estrogen and their progesterone. But I noticed that even with doing that, my patients were still complaining about problems with sleep, mood changes, night sweats, being tired all the time. You know, there's some of the hot flashes during the daytime had resolved for many of my patients, but they were still having the decreased focus and memory, the irritability, the anxiety, the depression. And I was not able to fix those symptoms with what I learned in residency and medical school. So I went on my research journey, and what I found was that testosterone is the forgotten female hormone. So even though a lot of doctors were replacing the estrogen that helps with hot flashes and night sweats, they were not replacing the testosterone. Okay. So with that being said, I went for hormone training. I got my first pellet. And with my first pellet, I got testosterone in that pellet. And it just really changed my life. I got my first testosterone pellet. I noticed that I was starting to sleep again. I wasn't having the night sweats anymore. I could focus a little bit more. My mood was better. I had great energy. I was interested in sex again. I was having orgasms again, and everything was great. So I found my answer to the problem, and it was the forgotten female hormone. Women need testosterone. And even though we don't get as much as men, we still need a small amount of testosterone. So that's my backstory. That's how I got into doing exactly what I do, which is gynecology with prevention and screening, total wellness, weight management, as well as hormone balance and intimacy, because all of those things come into play as we're continuing to age. So for you, my goal in this webinar is to teach you how to live a life of total wellness while enjoying everlasting intimacy. And as I just stated, that definitely will include making sure that you're hormonally balanced. During this webinar, my goal is for you to truly experience your beauty, balance, and belief for the rest of your life. I'm going to teach you how to do that today without feeling overwhelmed and confused, which many of us may feel, especially as we're experiencing all of these changes in our bodies as we age and as we mature. So I want you to stay to the end of this webinar, because although I'm giving you great information, we also have some absolutely amazing giveaways. The first giveaway is going to be an immune system bundle. We know that everybody needs to build their immune system during this time, and we understand the importance of that, especially with COVID-19. Also, our very best giveaways also include half off of a vaginal rejuvenation procedure, and I'll explain exactly what that is in this webinar, as well as half off of an O shot. So we'll have 3 different winners, and as long as you stay till the end, you will be able to win one of these amazing offers that will help change your life and help you achieve your wellness goals faster. So the goal is for you to learn more about weight management, hormone pellet therapy, incontinence therapy, vaginal rejuvenation, and O-shot benefits. And that is why you came to listen to this informative webinar, because I am going to teach you how to renew your intimacy and improve your total wellness by making sure you experience everlasting intimacy. So weight management, that is one thing that I focus on in this practice because I understand that for total wellness, we definitely need to maintain a healthy weight. It makes you feel better, it makes you age better, and it decreases the risk of many diseases. So the goal is also self-confidence in and out of the bedroom. We know that when you are maintaining a healthy weight, it's going to build your confidence. You're going to have better mobility and flexibility. It's going to increase your energy, and you're going to notice more pleasurable physical intimacy with healthy weight management. My weight management programs actually focus on behavior modification, no fad diets. They don't work. I want to teach you how to lose the weight the same way you plan on keeping the weight off. And here's a testimonial from one of my patients who says that she loves me and my staff, and she has been a patient at MiBella Wellness Center for over 5 years with consults and treatments regarding hormone health and weight management. I helped her to lose over 60 pounds in the last year. She did all the hard work. I just did a little bit of direction and showing her the right things to do with behavior modification. She says she's felt better than she ever has in her adult life, and that she has gotten new breath of life, and she is loving every moment of being able to maintain her weight and have hormone balance so she can truly experience total wellness. With my programs, we also have some supplements, and I think supplements are very important because we don't get everything we need from just our normal diets. We know that our food has changed, and with our weight management, instead of having to be on those appetite suppressants that may affect your heart rate, which some people need, but what we know is that appetite suppressants work for about 3 months, which is a good time to help change those behaviors. But we also have some great supplements that you can use to maintain your healthy weight, and that those supplements help with your appetite, your energy, your metabolism. They help you to hold on to your muscle mass, decrease your fat, and they just make your weight loss journey much easier because they help decrease those cravings. And then we also have supplements that help with hormone therapy. So hormone pellet therapy, that's my favorite way to balance hormones. We talked about the testosterone. So most of my patients enjoy hormone pellet therapy when they replace their testosterone. The pellet therapy is going to help relieve symptoms including decreased energy, mood swings, anxiety, depression, low sex drive. The pellets also help with bone density and many other conditions. So with the hormone pellet therapy, what's the difference in hormone pellet therapy versus traditional hormone therapy? Well, with traditional hormone therapy, that's going to include your estrogen, but that estrogen normally written in a prescription that you pick up from your regular pharmacy, many times that's going to be your synthetic estrogen therapy. With the hormone pellet therapy, those pellets have plant-based bioidentical hormones that can include estrogen as well as testosterone. And those hormones look just like the hormones that your ovaries produced when you were younger. The hormone pellets can have testosterone, which remember help with sex drive, energy, sleep, focus, memory, mood, joint pain, belly fat, orgasms. Estrogen, on the other hand, helps with hot flashes during the day, vaginal dryness, as well as some of your focus and memory and some of your mood. And then the benefits of hormone balance: testosterone decreases your risk of dementia, protects your heart, protects your bones. And some say that it's breast protective, but what I say is that we know that testosterone does not increase your risk of breast cancer. Estrogen will also protect your bones as well and help with the hot flashes, like I stated. So here's another testimonial from a patient. Dr. Cowan took an amazingly personable approach with me as she addressed my concerns. She was very thorough in her assessment and made sure I understood all pertinent information in terms I could understand. I feel like a new woman with her help given to me in balancing my hormones and maintaining a healthy weight. And they really go together, guys. Hormone balance and healthy weight go well together. Dr. Cowan and her staff exceeded my expectations, and I would recommend her to any and all seeking to feel their best, both physically and emotionally. So just the importance of hormone balance and how that plays with your weight management. Incontinence therapy. So incontinence is leakage of urine. There are 2 different kinds of incontinence. One is going to be your genuine stress incontinence. That's Leakage of urine when you're coughing, sneezing, jumping, laughing. That can happen after babies, with age, and with the changes in your vaginal tissue as you age. There's also the urgency. Gotta go, gotta go, gotta go. Can't always make it to the bathroom before I go. That would be considered urgency or urge incontinence, especially if the urgency causes you to leak before you can get to the bathroom. And then there's that frequency that a lot of women will experience as they mature in age and the vaginal tissue changes. And all of those symptoms and signs can definitely negatively affect the quality of life. Urinary incontinence affects a lot more women than we probably know, and this treatment is life-changing in such a positive way that you will never doubt getting it taken care of. So we'll talk in just a second about different ways that we can treat incontinence. So vaginal rejuvenation. As we age, just like our hormones change, the hormones in our vaginal tissue also decreases, and what that can do is it can affect your vaginal sensitivity. It can affect your lubrication, causing vaginal dryness and pain during intercourse. It can also, again, cause the pain in intercourse, and it can also cause a laxity of the vaginal tissue. So meaning it's not tight anymore. There's more laxity, so you don't have as much sensation. And as your tissue starts to age, it can also decrease your orgasms. So with vaginal rejuvenation, which we have a wonderful procedure here at MiBella Wellness Center, we use Vivive, and it is radio frequency that also has a cooling component. So there is no pain, non-invasive, takes about 45 minutes to an hour, no pain again. And what it helps is the aging vagina. It helps with vaginal sensitivity. It helps with tightening the vagina, and it definitely increases orgasms and lubrication. So you don't have to stop and go get your organic coconut oil during the middle of intercourse, because with vaginal rejuvenation, you will not need it. The aging vagina feels young again. She's lubricated, she's healthy, she's happy, and she's very orgasmic with a simple in-office treatment that is painless. Here's a testimonial. I received my vaginal rejuvenation treatment about a month ago, and I have noticed an increase in the tightness in my vagina. Also, I have noticed a higher desire to have intercourse, and I almost always feel sexually aroused during sexual activity and intercourse. The treatment is recommended once a year for maintenance, which I will continue to do. From my experience, this is the most effective non-invasive option for vaginal tightness and rejuvenation. And this is a big deal, ladies, because when women had stress incontinence, they used to have a major surgery where they went to sleep, and we used a material called mesh to help with the stress incontinence. Well, with this non-invasive procedure, you no longer have to go to sleep. You no longer have to have a major procedure, and we no longer have to use the mesh, which can cause complications in many women. Now, my ladies can come in every 12 to 24 months, have this procedure done in 45 minutes, and they can feel great. Another procedure that we offer at MiBella that we are super excited about is the O-Shot. And the O-Shot works a little differently from the vaginal rejuvenation. They work well together or alone. So after an intimacy consult, I can tell you exactly what you need. The O-Shot is going to improve your libido. It's going to improve your orgasms. They're going to become more frequent. You're going to get clitoral stimulation and the ability to have internal vaginal orgasms, which is really a big deal for a lot of women, because many women are not having orgasms internally. They're only having them with clitoral stimulation. But with the O-Shot, what that does is it takes your blood, spins it down, and then we replace that, can everybody hear me now? Okay, so I'm going to go back to Vivive because I understand that some of my sound was lost for some reason. So with Vivive, again, that is vaginal rejuvenation that is painless. We do it right here in the office after your intimacy consult. 45 minutes to 1 hour of a painless procedure where we use radio frequency as well as a freezing technology so that it's painless. But that is going to help with your vaginal sensitivity for better orgasms. It's going to help with your lubrication. It's going to help with vaginal tightening. And it's going to actually improve your libido just because it's going to increase the intensity of your orgasms and the lubrication so that you're more easily aroused and you have a higher desire for sex. But also, Vivive the vaginal rejuvenation procedure is also going to help treat your stress incontinence. It can completely relieve stress incontinence, meaning leakage of urine with coughing, sneezing, jumping, laughing. So the Vivive procedure is a phenomenal procedure that works really well. Most women only need one procedure, and that procedure is going to last you anywhere from 12 to 24 months. We just talked about the O shot. And with the O shot, you're going to get, okay. Okay, so with the O shot, here is the testimonial, but with the O shot, you're going to get improved orgasms, more vaginal stimulation, reduction of leakage of urine as well. And then it's going to help increase your libido as well as your internal vaginal orgasms as well as your clitoral orgasms. Here is a testimonial. I received my O shot roughly 2 months ago now. I have to say that it was probably one of the best decisions of my life. I noticed results of my concerns within about 3 weeks to this day. I still think of how much a quick and relatively painless procedure has improved my quality of life immensely. It's well worth it. With the O shot, there's no downtime. It literally takes me about 15 minutes at most to perform the procedure, but we do a numbing technique that makes that procedure last about 30 to 35 minutes. Again, it's painless and it works very well for leakage of urine as well as increasing your orgasm and your libido. If you can relate to any of the symptoms that we talked about, decreased sex drive, decreased orgasms, vaginal dryness, then this renewed intimacy offer is for you. I have set aside some time to speak to each one of you personally so that you can have an intimacy consult and we can figure out what your needs are. And during this renewed intimacy consultation, I will explain what the next steps are for you to begin your journey. Your renewed intimacy consultation will consist of an in-depth discussion of your symptoms and goals, a review of the solutions right here at MiBella Wellness Center, and an outline of your individualized system for success, which includes education, coaching, and accountability. So you will have the opportunity to sign up for this wonderful consultation by yours truly, Dr. Mia, so that we can make sure that you have everlasting intimacy, which is so important for your total wellness. And so if you've been on this webinar all this time, you obviously are interested in improving your wellness. There's something in this webinar content that spoke to you and your desire to change your life. And remember, it's not just about intimacy, but the importance of intimacy in your total wellness. Your renewed intimacy consultation will be the start of your change. It only takes about 20 minutes. And it's an investment in renewing your intimacy, which is probably one of the most valuable investments you'll make all year. So invest in yourself. Reserve your renewed intimacy consultation today. Remember, you are the most important person in your life. Stop putting yourself last. Make your appointment, because everlasting intimacy will change your life and change your total wellness. You're just one click away from your journey to renewed intimacy. You can schedule your consultation today. If you go to the chat, you can actually click and schedule your consultation, because your new beginnings are waiting. We are ready to help you improve your quality of life. We're ready to help you improve your weight management, your total wellness. And in order to truly have total wellness, it is necessary for you to have everlasting intimacy. So,
Hey, Doc, can we go ahead and start taking some questions now? We have a lot of wonderful questions for you. First of all, can everyone hear? I know there was some problems with the sound, which I hear perfectly, so I don't get that. Just get in a little bit closer, Doc, to your mic. So can you all hear Dr. Cowan? Give me a thumbs up. Let me know that you can. Can you still hear? Can everyone hear? Okay, I think everyone can hear you now, Doc. So we're going to go ahead and start taking a couple of questions, if that's okay with you.
Yes, that's awesome.
Okay, let's go to some of our questions. And hi again, ladies. And I see they're rolling in. So let's go to some of those. Okay, let's see. Let's see what we have here. Okay, Doc, as far as urinary incontinence, does that include frequent bladder infections after intimacy?
Very good question. So I would say that the vaginal tissue starts to age. So urinary tract infections after intimacy can be caused by a couple things. One, you need to empty your bladder if possible before intercourse, but definitely after intercourse. So emptying your bladder after intercourse should decrease the number of urinary tract infections that you have. Also, urinary tract infections as you age can come from lack of estrogen in the vaginal tissue. So even though we have these wonderful procedures and intimacy solutions here, some of the things that everybody can be doing to maintain healthy vaginal tissue would be to, one, start treating the tissue before it becomes a problem. So even though I'm in my 40s and I'm not postmenopausal, I regularly treat my tissue at least twice a week with either a product that has hyaluronic acid in it twice a night, right before I go to bed, after sex, not for sex, but after sex, or when I'm not having sex. And that's going to help rebuild the tissue so that when I'm having sex, I have a lot of lubrication so that I can improve my enjoyment and decrease my dryness. And then also estrogen vaginal topical replacement is going to help to rebuild that tissue, because as you're transitioning into menopause, the estrogen declines systemically in your body. So completely your estrogen levels will decline, but that also affects your vaginal tissue. And the vaginal tissue not having estrogen causes it to thin. And that's what can cause the dryness, which can also cause thinning of the tissue around the urethra, which actually increases the risk of urinary tract infection. So by treating the vaginal tissue before you start to have a problem and then treating it throughout menopause, that will decrease the risk of those urinary tract infections. And again, some women are going to get to the point where they actually need procedures done to help not only with the vaginal tissue and decrease in the urinary tract infections, but also just with intimacy in general.
Okay, Doc, we have another question. Does the VIV procedure help with incontinence?
Yes. And so I don't think it's gotten its FDA approval yet, but that's what they're working on. But it's one of the procedures that can be done to actually stop stress incontinence. So I have many patients who were having problems with leakage of urine, with coughing, sneezing, jumping, laughing. And so those women who had the VIV procedure noticed that resolves. Now, it doesn't resolve forever. So a lot of women know that they need that procedure again after 12 to 24 months. But with that procedure, it improves lubrication, but it definitely can completely resolve stress incontinence, meaning, again, leakage of urine with coughing, sneezing, jumping, and laughing. And I actually noticed an improvement in urgency as well, meaning gotta go, and just always going to the bathroom. When you pass by the bathroom, you gotta go. Before you leave, you gotta go. You notice that urgency and frequency will decrease after the VIV procedure as well.
Okay, they also want to know, and you just talked about the VIV procedure, what's the name of the other procedure for incontinence?
That is the O shot. So the one that we offer here at MiBella is called the O shot. And those procedures actually work really well together. Some of my patients who have just really mild symptoms can do VIV alone. My patients who have significant symptoms, they've been going on for a while, may do better doing the VIV procedure. And if that doesn't completely resolve all the symptoms, we can also add that O shot on top of the vaginal rejuvenation with VIV. So the O shot helps with stress incontinence, urgency, and frequency, and so does VIV. It helps with definitely stress incontinence, but a lot of women also notice a huge improvement in urgency as well as frequency.
Great. Can you get both procedures done, Doc?
Yes, I had both procedures done, and life is really good for me. So I have a lot of women. I have all women on here. Most of the women who are listening to this are probably over 35. And so what you may notice, even as you age, is that just with urination, you notice that you have a very strong, steady stream when you're really young. But as you age, you notice that that stream is not as straight and clear and obvious as it was before. And so those procedures actually help with the stress incontinence, help with the flow of urine, and it also, makes sure that you have those intimacy improvements so that you can enjoy intercourse more. So the procedures work well alone. Many women can do the VIV and not need anything else. But again, for those women who have significant or severe symptoms, doing the VIV along with the O shot will help significantly decrease all the symptoms and significantly improve intimacy and orgasms.
Yes, it does on the orgasm part, Doc. Very much so. I just want to throw that little part in there.
And you know what I say? if more women and men had orgasms, we'd have a nicer and a happier world. So that's one of the things that I'm planning on doing, is increasing orgasms in my patient population so that we're happier and healthier.
Okay, Doc. Which is better, cream or pellets? And how do you know if you are better off with the pellet in the hip or the cream?
So from doing this for the last, let's see, I got my first pellet in July of 2014. And I initially started out working with the creams, but for a lot of my patients, it's hard for them to be compliant. So with creams, you have to do creams with 2 clicks in the morning, 2 clicks in the evening, around the same time every day. With the pellets, I place the pellets. They go in your hip area on your buttocks. I numb you, make a teeny little incision, and put your individualized dosing. So that's another difference. With the creams, it's a generic dosing. I start low for everybody and slowly move up. With the pellets, I can individually dose you specifically based on your weight, based on your history, based on your labs. So it's more individualized, and pellets can last anywhere from 3 to 5 months. On average, I get my pellet every 3 to 3.5 months because I never want to feel that low where all my symptoms come back. For some women, they can go a little bit longer, but on average, it's anywhere from 3 to 5 months. So I personally prefer the pellet, and most of my patients do. When my patients are on the cream and I switch them to the pellets, they're like, why did you let me do the creams? Why did you let me waste my time with the creams all this time? And it's because I don't want to push anybody to having to do anything. I want you to be comfortable with your decision. But if I asked all of my patients about their satisfaction, my patients who are on pellets, I say I have about a 90 to 95% satisfaction rate. And on creams, it's about a 65 to 75%, especially if those patients can be compliant and maintain a healthy regimen and do it 2 clicks in the morning, 2 clicks in the evening.
Okay, Doc, another question we have. And then after these questions, we're going to go ahead and give the results of the poll. And I hope all of you were able to get in on that. But if not, we'll go ahead and give those results. Are these products okay to use if you've been diagnosed with IC?
Yes, with interstitial cystitis. So that's pain with urination. It's kind of like an autoimmune disease of the bladder. So the O shot has shown to decrease pain with intercourse as well as Viviv. So those treatments should actually help with interstitial cystitis. I'm not saying that that's a treatment. I'm not saying that it was FDA approved, but both of the treatments that we talked about for intimacy are going to improve pain during intercourse. So most women with IC will notice a significant improvement because many of those women experience pain during intercourse with interstitial cystitis.
And we had a couple of questions, ladies. It should be in your chat. You should be able to click right on the button and it takes you right to where you can schedule for your consult. We would definitely love, or and Dr. Mia would love to meet with you and talk to you about all of your needs. So click that button and Dr. Mia will be more than happy to schedule a consult with you. You'll have the times and dates available for you. One more question, Doc. If I'm already receiving the pellets, what would be my next step?
So that's what I'm doing the intimacy consult for. So after talking to you, getting your history and doing a very thorough exam, we'll figure out what the best next step is for you based on your symptoms, based on your exam, and based on what we're trying to treat, whether it's just intimacy versus intimacy and incontinence. And again, for many women who have severe incontinence, they may require both procedures. So after the intimacy consult, over the phone, as well as coming into the office and allowing me to do your exam, we'll have a better idea of your treatment plan. And then I'll give you my recommendations and we'll go from there.
Okay, let's go over the results of the polls. Well, we had 2 polls, ladies, and I hope all of you were able to get in on those. But our first question was, how often are you intimate with your partner? And the results were 40% of the results were 3 to 5 times per month. So that's good, ladies.
That's about average, yeah, 1 to 2 times a week. That's good, ladies.
That's very good, ladies. Whoop, whoop. And our second poll is...
What were the other results? It was just 40% for that. What were the other numbers?
40% were 3 to 5 times per month. 33% was less than twice a month. And 26% was 6 or more times per month.
Yay. Well, how many for 6 or more times per month?
6 or more times a month was 26%.
Now they get a real heads off. That's what's up, because the more intimacy you have, the better for your total wellness and the better for you and the better for your relationship. So kudos to the women who do that 6 times and up per month. That's awesome.
Our second poll, Doc, was how often do you have orgasms? 10% never have an orgasm, 25% rarely have an orgasm, 48% sometimes have an orgasm, and 15% always have an orgasm.
And that sounds exactly right according to the literature. So a lot of women feel bad and don't like to have this conversation, but it's very common, especially as we age, to not have as many orgasms. But that's why we now have great intimacy solutions to make sure that every time we can possibly make sure that every time you have intercourse, you are having orgasms. And those changes happen because of the changes in our body. So by actually using some of these intimacy solutions, we can improve that vaginal tissue, improve enjoyment, improve tightness and lubrication to ensure orgasms on a more regular basis. So it's very common for women to have never had orgasms. I think 10% is about right, but it may be a little bit more. And when you have that first orgasm, you realize it. And whenever somebody says, I'm not sure if I had an orgasm, they probably haven't, because it's such an intense climax and such an intense feeling that once you have one, you know exactly what it is. But the good news is that you don't have to go the rest of your life without enjoying regular orgasms, because we have so many intimacy solutions, including our hormone pellet therapy, that can help significantly improve orgasms and enjoyment with intercourse.
Hey, Doc, one more question. Can you tell our ladies, how does the IV treatment work and what is the treatment like at the office?
Okay, so in the office, it takes about 45 minutes to an hour. And then you basically have your legs in stirrups. And we have a very small probe that we use. And we have an actual protocol that we use. So that won't matter to you. But all you know is that we are using a probe to actually put radio frequency and a cooling treatment on the vaginal tissue, which helps to rebuild the collagen. And that's what actually increases the lubrication, the sensitivity, and the tightening of the vaginal tissue. So it is a painless procedure. So have time to talk. We have our music on. We make it a very relaxing experience. And again, there's no pain. It's just a matter of getting through the 45 minutes to an hour with the probe. And there's no pain. It's the machine does all of the hard work.
And I can attest to that, ladies. There is zero pain, but
Zero pain.
100% benefit.
And some of my ladies may have had one of our vaginal rejuvenation procedures that we had in the past. And with that procedure, it worked fine. It didn't work as well as Vivi, which is why we switched over, because it's a great product and a great service. But those women would experience some discomfort and some pain. With the Vivi, that was one thing that really made me want to do the Vivi. Besides how well it works, it's a painless procedure. So anybody can do it and most people can tolerate. Even my older patients who may have more difficulty with their vaginal tissue, they can still easily tolerate that VIV procedure. So it's an excellent procedure for everything. And y'all, it's we've already have 3 consults scheduled. You got a minute to get the last 2, because the first 5 attendees who sign up for their renewed intimacy consult will receive the Ageless Balance T Support. And that's one of my supplements that helps to naturally increase your testosterone levels. Even though I get the pellet, I still do the T Support, and I increase the amount of the T Support that I use as I get closer to needing a new pellet, or when I first get my pellet and it has to kick in, I can increase the T Support supplement to 2 a day. And that will help me with my symptoms of with energy and sleep and focus and memory and my sex drive. So T Support is an awesome supplement made by Ageless Balance with Dr. Nia, and it is a great supplement to use for women who are having mild symptoms, as well as women who are having severe symptoms and they want to use it in combination with hormone therapy. So the choice is in your hands, ladies. Go ahead and sign up for your consult. My goal for you is to live a life of total wellness, to experience your beauty balance and belief so you can always live well, age beautifully. And you need renewed intimacy to do that. It's not just about your prevention and your supplements and your weight management and your hormone balance. We have to include that total intimacy in there, because that is going to make you live about 5 years longer than women who don't have regular intimacy. So it's important for your total wellness.
And we're going to go ahead and tell who is the winner of our 3 amazing prizes.
So the winner of our free immune system supplement bundle is ding, 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 ding. Who is
Miss Treba Miles. Miss Treba Miles, you are the winner of our free immune system supplement bundle. Woo, woo.
So you need to write in the chat, are you still here? Because you have to be here to win.
Present to win. So let's see. Treba, can you type in there and let us know that you're still here? Okay, she's here, Doc. She just typed yes. Also, put your contact information in our chat for us, please. And Doc, can you tell them how they will get their immune system bundle?
They can call us at 205-995-1009 or email us and they can just come right by the office and pick it up.
Okay, and Treba, when you put your information in, can you do it privately? So, everyone won't have all of your information. You can just send a private chat and we'll
email us.
Yeah, or email us
at info@MiBella Wellness and we put your name down.
Right. Yeah, I just want to make sure you get it. Okay, now we're going to move on to the winner of our 1/2 off of the vaginal rejuvenation procedure. And
now
I'm going to tell you, it is huge. And it makes a gigantic difference in your pleasure, your orgasms, the intensity, the lacticity, what is it? The laxicity of your vagina, it is 100% worth it. So the winner of our 1/2 off of the vaginal rejuvenation procedure is Melanie Long. Melanie, yes. Melanie, are you still on? Let us know. You have to be present to win. Are you still on with us, Melanie? Let's see if Melanie types up that she's still on. Yep, she's still here.
Yay, Melanie, you got a good one, girl.
Yes, you did. Yes, you did. Okay. Also, yeah, just make sure you send that information so that we can get everything scheduled for you. You can send your information to info@MiBellaWellness.com or give us a call at 205-995-1009. You can also click on the offer in the chat section. You can click on the schedule your consultation and it will tell you the days and times that are available. Okay, let's go to our next giveaway. It is 1/2 off of the O shot.
The O shot. You know what the O's for?
The big O. And the winner of the 1/2 off of the O shot is Tan Jemison. Now, Tan, that's our Tan, right?
You cannot win.
Yeah, you can't win. So we're gonna pull one more. I was like, wait a minute, isn't that our Tan?
Yes, that's our Tan. Tan cannot win.
Exactly.
Now we have another drawing.
We do. And the winner of our 1/2 off the O shot is Delicia Godfrey. Is Miss Delicia still on? Let's see if Miss Delicia Godfrey is still on. She hasn't put anything in there yet. You better hurry up, Delicia. We're going to move on.
10 more seconds.
9, 8, 7. Yep, there she is. Yay! Yes, good. Okay, Delicia. So make sure you send that information so we can get you scheduled. And again, you will be so happy that you did. Doc, do you have anything else you want to wrap up with?
Well, I just want to say thank y'all so much for joining us on this webinar. I hope that you learned something. I hope that you can understand that you can truly live a life of total wellness and including renewed intimacy, because remember, total wellness includes your prevention, your weight management, your hormone balance, as well as your total intimacy. So thank you for joining. Y'all have a great evening. If you want to schedule that consult, go right ahead, because the first 5 people get that tea support for free. So I think we have 3 bottles already going out and we have 2 more left. I think somebody else just joined in. So they're done. We have our 5 first consults. But you still want to go ahead and get this consult because it is at a discounted rate. And your actual consult will come off of your total cost of whatever service you decide to do with intimacy. So if you do the Vivive, that consult fee will come off of your Vivive procedure. If you do the O shot, that consult fee will come off of your O shot. So everybody who came and participated in our webinar today will definitely get some great rewards, and we appreciate you. And we also want to say a big shout out to Addie, which Addie is an FDA approved product that is for sex drive. It helps with libido. It's a prescription drug that your gynecologist, hopefully that's me, can write for you, and that will help with your sex drive. And then we also have a wonderful new amazing intimacy solution that we'll be talking about in the next few weeks. So we'll probably have another webinar, and that is called the O Wave. So stay tuned to learn more about that. It is Dr. Mia. Thank y'all so much for joining us. Have a wonderful weekend. Be safe, be well, and be healthy. Bye.
Good night, ladies.
Bye.
Bye-bye.
Have a good one.
Thanks,
Thanks for
Dr. Mia.
joining. Thank you, Stephanie. You're awesome.